funny. What?
He's like, I'm ready for lunch. Yeah, my wrists make crazy noises like all the time.
Your wrists?
Yeah.
Both of them?
Yeah. Well, they don't like hurt or anything, so.
I remember the first time someone did that adjustment on me, I was like, oh my gosh. It was this acupuncturist, this Chinese acupuncturist. You know, I've been to chiropractors, and this guy just walks up, just going, I was like, dude, that was awesome, bro. That felt so good, especially because I work with my hands so much.
Yeah.
It's funny too because I got him that cat thing, whatever,
Yep.
cat tree. And I mean, when I first got it a couple weeks ago, they would both really fit really snugly in the top thing, you know. And
Yeah.
they're growing fast. Like I think faster than I realized.
Oh yeah. You know what? Whenever I had a cat, I'd take a picture with my phone next to them and like do the size comparison.
Yep.
You know, and it'd be like crazy how big they get so fast.
This side is being a little bit more stubborn, I feel like, for some reason.
Oh yeah. That one I can feel it's just a little higher.
What's that?
That one over by the shoulder blade, it's like it goes up just a little bit higher.
Mm-hmm. Yep.
And it's like, oh yeah, it's brutal in there.
Yep. The tip of the iceberg is right here, right? So you just kind of break it down.
Yep.
Around the edge, you know. But right in the middle of it's where it's like.
Yeah, there you go.
Had someone hit me up and wants me to go work out of their gym in Minneapolis. I don't know.
Like a friend or like somebody that just like wants to.
Just like a fellow business person in the fitness industry, you know. He owns a gym. I think I've met him maybe once, or I don't even know if I don't remember maybe if I met him in the beginning of things, but he's kind of started, I think, when I did, or not started, but he's just got a pretty decent following, I guess.
So you're talking about like doing physio work there, or literally just
Yeah.
like, you know?
Probably just, I don't know, me, whatever I do.
Yeah.
Everything I can train people, but a lot, sometimes, you know, they're looking just to fill rent space there, you know?
Right.
And they think that they can
Turning
make,
around.
you know, $800 a month off me, you know, and I'm alright with that. I'm not trying to do that right now. I don't need to, you know.
Yeah. Well, you just gotta ask yourself what you want to do, you know?
Yeah, where was the couch when you came here? Was it down the hallway?
Yeah.
Yeah. Yeah, I held that bitch outside by myself, down those stairs.
Jesus.
Well, actually, I held it down the hallway to the other stairs, and then hauled it downstairs. And I roped it up myself too, but it was just too. There was no way I could have done that by myself.
You know, so you're just talking about like kind of what you want to do. I started applying to a couple hospitals, you know, and I kind of was like, you know, last department I worked was the emergency room, and I was kind of thinking to myself, like, you know, I don't really know if I really want to do that again.
Yeah.
It's cool and it's fun, but
That's a lot, bro.
Yeah, I mean,
emergency room trauma. Oh my gosh, dude.
yeah, I mean, you know, when it's like I could do it and no problem, you know, and it's, you know, it's not like I don't lose sleep over it, you know what I mean? I can do it. I just was like, you know what? Like, for like the same, because typically the pay rate is just based on experience. It's not necessarily department wide. Some departments have a differential, you know, but other times they don't. So kind of like just kind of thinking like, you know, I could kind of cruise just on a regular general hospital floor, you know, because it's like pretty. I mean, when you're like experienced, you know, and you don't really have to think too hard about everything. You just kind of like roll through, and you know, you do your meds, and you say hi, you make people feel good, and
Yeah.
you move on to the next person, and then you punch out and you go home.
And you got to deal with the chaos of the ER.
Yeah, the ER is like, you know, it's cool when you get to rescue people who like, you know, like young girls or like suicide attempts and crap and whatever else. But like, there's just a lot of like really aggressive, angry meth heads, pretty much like as like a sort of like a revolving door.
Yeah.
And you're just like, all right, come on.
Yeah, that would be a lot. I seen that one time when I went down there.
Because it's just like, they'll show up to the emergency room and they're like screaming at you, and you're just like, so why are you here? And
Go to the
I'm
VA.
like, oh, the police dropped you here. Okay, sounds good. You know.
The VA, an emergency room ain't like that.
Yeah, that's actually I was gonna consider. Actually, that's the next on my list is apply to the VA.
Yeah, that's more just older veterans, you know.
And they usually do things. They really appreciate it. You know, like that's the thing. It's like one of the things that's hard about being a nurse is when the people don't appreciate you. And you know, and I do find like my old Vietnam vets and stuff are always like really cool and appreciative.
the hospital's got certain, regulations and guidelines that it has to follow, and even in the midst of all the chaos. Sorry, we still have, yes, I understand you're feeling this way, but it's like we're not allowed to do, it's like this is. But yeah, when you go into those places, and I've seen it. I've been in the ER freaking 13 times in the past 2 years, so it's like
yeah.
There's been days where I've been kind of like upset, like, and there's most of the time I'm just kind of find something wrong with you. Like, what's wrong? And they're like, bro, it's just anxiety.
Yeah, I know. I could imagine like being your nurse and be like, all right, we're gonna 12 lead EKG, vital signs, like let me check your pupils, like how's this, do a quick neuro exam. And be like, well, your heart rate's ticking away at 130. Like, did you have any caffeine today? Those would be like my questions,
Yeah.
And then eventually, sometimes it's hard though to have like a nice private conversation with a patient when you like really want to, especially if it's something more emotional. It's like it's hard to do that in the emergency room because everything else is beeping and yelling, and you're like, I know you need to have a low stimulation environment, but this is like the emergency room, so it's crazy all the time.
Yeah, every time I go in, I get an EKG done, and they never find anything wrong. But it's a fucking shitty place to be at, man. You can't, like, your life is basically just every day I would think of going to the ER. There were so many days where I had to fight the urge because I was feeling so fucking off and shitty and scared that something was going to happen to my heart or something, where like I would literally have to fight the urge to go to the ER all the time, not call 911, like it just, and it's not like I chose that,
No, of course.
I don't want to fucking live that way. I want to go back to the gym, and I want to, I want to be, I want to be capable of functioning, but when you're in that place, it's hard to function. It's hard to take a shower, it's hard to, do those simple life things, let alone run a business or help other people, or go through anything else that's stressful,
Sometimes I refer people, to our psych emergency department, which is harder to deal with, like for, but it's often like better in a way because if you're like, okay, you've been cleared medically, like, you're not having a heart attack, you're good. I was like, but clearly, you're in a critical anxiety attack. Like, let's try something different, And that often helps people.